Is there anything that pet parents can do to help prevent some of these side effects and help the body deal with the antibiotics a little better?
So the first one that is like incredibly important. The second one would be the third one because of, and the fourth one, those four things should be in your toolbox, no matter what drug you're using. Universities should not be sponsored by companies that gain. It shouldn't happen. It's a complete oxymoron. The lack of education, that's probably better, of the understanding of what disease follows the overuse of antibiotics or the incorrect use of antibiotics is not even taught.
Whenever you or your pet are being prescribed an antibiotic, you have to ask these two questions. And if the answer is no to both of these questions, then that means...
Welcome back to the Next Level Pet Parent Podcast. Today, we're diving into a topic that every pet parent needs to understand: antibiotics for pets. Antibiotics can be life-saving, and there is definitely a time and a place to use them. But here's the problem. Antibiotics are massively overprescribed in conventional veterinary medicine. This overuse can lead to some serious long-term health issues for your pet, like gut damage, weakened immunity, skin problems, and even antibiotic resistance. But here's the good news. You have more control than you think. Before agreeing to antibiotics, there are two crucial questions that you need to ask your vet. These questions could mean the difference between unnecessary medication with side effects and a treatment plan that actually supports your pet's long-term health. Today, we'll be sharing exactly what those questions are, along with expert insights on how to advocate for your pet in the exam room. And to help us do that, we've got an absolute legend in the world of holistic pet health joining us today, Julie Ann Lee. Julie has been the owner and practitioner of some of the biggest holistic veterinary hospitals in North America. She's a founder of Adored Beast and brings decades of experience of both integrative and holistic veterinary care. So if you've ever questioned whether antibiotics were really necessary for your pet, or if you just want to feel more confident the next time you visit the vet, then this episode is for you. So stick around, because this can change the way that you advocate for your pet's health forever. Now, let's get straight to it.
Julie, welcome back to the podcast. Thank you so much for taking the time today to talk about a very important topic, which is antibiotics and how to prevent side effects from antibiotics on our pets. We are very passionate about raising awareness about this topic because both Milka and I actually had some health issues that came right after using antibiotics in the past. And today, we definitely know better. We know which questions to ask our vet or our doctors before accepting antibiotics. And we actually have been able to avoid them now for the past 7 years, which is really great. And I know that you've been the owner and practitioner of some of North America's busiest holistic veterinary hospitals. And from what I understand, you've been a lot of the times kind of like the last resort when it comes to pet parents who've tried everything else and nothing worked. And by the time that they get to you, a lot of them already had a lot of antibiotics and a lot of medication prescribed to them. So you've seen a lot of the after effects of what these antibiotics did to these pets. So can you tell us a little more about your experience from the times in your veterinary hospitals, what you've seen?
Yeah, I mean, I think that antibiotics are useful in the right situations, right? Useful, life-saving. Our problem with them is that they're overused, really overused. And still to this day, a lot of doctors and some veterinarians are starting to understand the side effects of using them too often. And not only, I think, I think that came from not the side effects that it causes on us, but the fact that bacteria and viruses, and virus not so much, but bacterias are becoming resistant to antibiotics because of the overuse. So they stopped working. We were getting things like, antibiotic resistance bacteria that were, life-threatening bacteria that we didn't have antibiotics to even address anymore. So the medical field started looking at, we're using too many. Billions and billions and billions of dollars are going into finding new antibiotics because we have so much resistance to them now. It's incredible for me to think that animals just go on them, or people just go on them without doing something called a culture and sensitivity. If you're feeling like an animal needs an antibiotic or a person needs an antibiotic, it's vital to do a swab, right? To do a culture and sensitivity, to find out, to make sure that you're using the correct antibiotic for that problem. But it's so surprising. It's hardly ever done. But how many times have you been asked that? How many times have you gone in
Never.
to a doctor or a veterinarian and they say, well, we want to do a throat culture on you first, or a swab on your tonsils first, just before we give you antibiotics, or we want to do a culture and sensitivity on the dog's urine before we start them on antibiotics, or we want to do a culture and sensitivity on a skin scraping or whatever before we do that. And I think that that's our biggest downfall, right? I think that's our biggest thing, is that we just routinely throw antibiotics, and the harm that it causes in the gut, of creating such an imbalance in the gut.
Mm-hmm.
And then the domino effect that happens because of that after is unbelievable. And then on top of that, I want to use ignorance in a way, but it's not ignorance in a crude way. The lack of education, that's probably better, of the understanding of what disease follows the overuse of antibiotics or the incorrect use of antibiotics is not even taught. So the assumption then that it's a new disease, and it's not a new disease. It's still the same disease, but now you've got all these other side effects because you've destroyed all of the incredibly important bacteria in the gut.
Yeah. Mm-hmm. And that's such a good point. We're definitely going to be talking about gut health a little later, and how long it takes for the gut also to recover after antibiotics. But before we dig into that, can we maybe just clear up for anyone listening right now, what exactly are antibiotics? Let's just start there.
Well, antibiotics are a class of drugs that attack pathogenic bacteria, right? They're used to attack and eradicate the pathogenic bacteria that's causing that specific problem. So if you have a bladder infection, if you've got bronchitis or pneumonia, or you have, some kind of infection that you have to address, antibiotics kill those bacterias. And they have different classifications. Different classifications kill different classifications of pathogenic bacteria. So that's why I was talking about it being very important to know what classification that you're even dealing with, or what species of bacteria that you're even dealing with, pathogenic bacteria that you're dealing with, to be sure that you're addressing those bacterias, right? And not killing the gut, the microbiota of the gut, and not even actually destroying the pathogenic bacteria that's causing the disease. Mm-hmm. So it's, and then we have some antibiotics that are called broad spectrum, which try to envelop many different kinds of bacterias, but they're hard hitting, and they don't like to use those a lot because of creating resistance, right? You're using this hard hitter that you may not need to use. Therefore, when you do need to use them, they don't work. Right? So then if an animal or a person gets a very life-threatening disease with a particular bacteria, you go to use that antibiotic and it no longer works because that bacteria in that body has become resistant to that antibiotic.
And would it be fair to say that like an antibiotic is a drug that enters into the gut and it just completely wipes out all bacteria, doesn't discriminate against good or bad.
No, it doesn't discriminate between good and bad, but certain antibiotics will target certain pathogenic bacteria where others won't. But when it goes in, it destroys the majority of good bacteria.
Okay.
Right? So let's say it's looking for streptococcus or something like that.
Yeah.
You're using a particular antibiotic that has known benefits of targeting that particular pathogenic bacteria. It targets that particular pathogenic bacteria, but then it also destroys the friendly bacteria that goes along with it, that is in there with it. But if you use an antibiotic, if it's streptococcus, I'm just using that as a generic bacteria, pathogenic bacteria. We could use E. coli or salmonella or clostridium or whatever, and you're using that bacteria or that antibiotic, but it doesn't kill those pathogenic bacterias. Then you're putting that antibiotic in, and you're not even addressing the actual core pathogenic bacteria that's causing the disease or causing the problem. Yet you're
while destroying the gut
still
health.
destroying everything else.
Exactly.
Or like I said, using too big of guns that you're putting in a huge broad spectrum antibiotic. It's killing everything, but it's also allowing the body to get used to or resistant to that antibiotic, so that when you do need those big guns, they don't work.
And you already mentioned that antibiotics are a lot of the times overprescribed. In general, what are the most common reasons conventional veterinarians would prescribe antibiotics?
I think I saw the overuse mostly with bladder infections, right? Just giving an antibiotic without doing a culture and sensitivity. That I saw repetitively, dogs becoming antibiotic resistant. Like, you literally, well, we can't use that anymore because it's been used so often. Now it really does have an infection, and we don't have anything in our box here to be able to prescribe. Another one is GI stuff. It's prescribed so often for GI, when changing the diet, giving probiotics, giving something like slippery elm or marshmallow root to soothe the gut, could be used instead of antibiotics. See that all the time. Ear infections, constant antibiotic after antibiotic after antibiotic. Skin infections, hot spots, things like that. I would say that those are the ones that I saw the most. And for poor cats, the amount of antibiotics that are prescribed for cystitis, for bladder infections, and they're not even bladder infections, right? They're symptomatic like bladder infections, but they're interstitial cystitis or sterile cystitis. So antibiotics aren't even working. They go in, destroy the microbiome, bring down the immune system, make them more susceptible to everything, including inflammation, which is the cause, not the bacteria is not the cause. So those are the main ones that I've seen.
Yeah, and it's so crazy because like puppyhood is such an important time for the microbiome to develop. So to introduce something like an antibiotic that destroys their gut health, which definitely impacts their immune system, is such a sad thing.
And we can actually attest to that. Like, a lot of pet parents that come to us that say that their dogs or cats have been on antibiotics, a lot of them have gone through diarrhea, which to me is such a crazy thing, because Milka just had like diarrhea the other day, and it was really bad. She hasn't had diarrhea like that in like 8 years.
Yeah, I think she went out into the garden and she ate something really, really bad.
Yeah, she ate something she wasn't supposed to, and she had diarrhea for a longer time. And usually, always, gut soothe helps her within 24 hours, always. And this time it wasn't enough, so we just put pumpkin in her food, and it was fine the next day. So I just I know if we would have gone to the vet, we would have gone home with the antibiotic, which I know so many pet parents are in this situation. And it's just so heartbreaking because it starts a cycle of, like, it starts that cycle that sometimes becomes so hard to close, is when you get that antibiotic and then that antibiotic causes diarrhea later. Like, it's so weird how that goes.
We have to talk about the elephant in the room, and we have to call it for what it is. It is metronidazole. It's the #1 antibiotic that is prescribed for
GI.
animals that have, symptoms of diarrhea or loose stool. And we see this all the time. So what are the side effects of antibiotics, and one such as metronidazole?
Well, it's because it's a different classification, right? So you can see heavier hitters when it comes to, chronic diarrhea, chronic inflammatory setup of the GI system. Some animals have really bad side effects to that when it comes to neurological stuff, when it comes to liver stuff. That classification of antibiotics, we're not just dealing with the eradication of friendly bacteria. There's an added concern about much more of a systemic side effects.
And generally speaking, what are some of the common side effects of antibiotics, and what does it do to our pet's gut, and how long does it actually take for the gut to recover?
Well, that's really individual. Like that's a really individual situation, because sometimes they're getting antibiotics because they have a problem that's already caused because they don't have a good microbiome, right? So their immune system is really not very good because they were born with a very, very minimal diversity in their gut. So if that's the case, it's going to even take longer because the antibiotics go in and destroy already a gut that's set up to fail, right? That's set up that it's already unhealthy. Sometimes if an animal they're fairly healthy, they do just exactly what your dog did, right? She's been on raw, she's been on supplements, she's not over vaccinated, she's a strong, healthy dog. She goes out, she eats something that's really gross and the body's rejecting it, and it's got, pathogenic bacteria, and she goes in and she gets put on antibiotics. Chances are she's going to recover faster. You'll be able to reintroduce all the good friendly bacteria, feed her, maybe some higher fiber, get some more kefir in her. Like the list goes on and on of the tools that we can to rebuild the gut microbiome. That's probably going to be a faster, easier way, or a dog that has an easier way of readjusting to the antibiotic. So it really depends on what state that they're in. The other thing it depends on is age. What else is going on in their body that that we're talking about? Like we had a discussion about cell health. Did that antibiotic create even something that is detrimental to cell health? So it's not just dealing with the side effects of destroying that microbiome. So those animals are going to have more of an intense regime that supports more overall health, because it's affecting the body on more of a level than just the microbiome, right? It becomes this, remember we talked about this cyclical effect. So it could range anywhere from 3 months, right, to just get everything sort of reestablished again, or on its way to being really reestablished and recovering, 2 years, right? If an animal's been on antibiotics for a very long time, chances are then they have leaky gut, right? They've got a thinning and a degradation of the mucosal lining of the gut wall. So not only are you trying to reestablish the microbiome, you're also having to heal the gut lining So there's another layer to it. And I see that a lot with GI issues that have been repetitively given that antibiotic of choice.
And honestly, like it's so crazy because a lot of the times pet parents may not connect the antibiotic that they gave 3 months ago or even 6 months ago. They might not connect that to the symptoms that they're seeing today in their pet. So like oftentimes this will be like, oh, I just changed to a new food. The food must be bad because now my dog has diarrhea. But that could still be the effects from that antibiotic that you gave so many months ago that probably we all forgot about that already. So it's a very difficult.
You're 100% right. And that's sort of what I said at the very beginning. Vets aren't even taught of what is the long-term effects of antibiotics. We're looking at short-term vomiting, it's so crazy because when you're talking about the drug of choice, the antibiotic of choice, when it comes to diarrhea and GI, the pink elephant, the side effects are vomiting and diarrhea. Right? Like that is a well-known side effect of that antibiotic. So that's what they're looking at. They're looking at the side effects of that antibiotic, and they're looking at it to happen just within the course of the antibiotics. They're not looking at the long-term domino effect of, oh, isn't that interesting? We treated, cystitis, and now 3 months later, we've got a GI issue. Or we treated cystitis, and 3 months later, we have geriatric vestibular syndrome. When you give an antibiotic or when you give a drug, but let's just talk about antibiotics right now, and you destroy the microbiome in the gut, that animal will develop something that's a side effect, if you want to call it that, or an effect of the microbiome changing in the gut, individual to that animal. So if it's a German Shepherd and it has a predisposition to perianal fistulas, or if it's a Cocker Spaniel and it has a predisposition to getting polyps in its ear, or if it's, a Min Pin and it's got a predisposition of collapsing trachea. Like the list can go on and on and on of what their predisposition is. That predisposition should not show its ugly head until that animal's quite old, right? Where the genetic mechanism starts happening, where, they start to show as they age their weak points. Those weak points can start really young with the overuse of antibiotics and the degradation of the lining of the gut and the removal or the imbalance of the microbiome. So to even say this is a side effect of antibiotics, that's why it's so difficult for conventional vets to even fathom this, because you have to understand that with leaky gut syndrome or with the imbalance of the microbiome, the result is going to be sort of a sped up version of what that genetic predisposition would be, weak point of health of that animal or that person.
Yeah.
So you have to think really hard. What would you have to do? You have to do a lot more digging, right? It's like if I was your homeopath and you came to me and you said, okay, well, this happened and I took antibiotics and this happened, I would say to you, okay, what's your history? What's in your family's history? What is your environment like? I would be able to then sort of go, oh, okay, more than likely you're going to gotten antibiotics. This is how your body's going to respond to those antibiotics based on your individual, something that a lot of them can even contemplate.
And also as pet parents, we trust in our veterinarians to know all the things, right? To do what's best for our pets. So we've raised quite a lot of awareness in the past about a certain antibiotic called Metronidazole, which I think we're going to talk a little bit more in depth later because it is such a crazy antibiotic. But since you're on the topic of veterinarians and how sometimes they may not know about all of the side effects, we actually have a comment on one of our old YouTube videos that we would like to share.
This video was about just a short clip about metronidazole, where we spoke to Dr. Kendra Pope, integrative veterinary oncologist. And one of the comments came in from someone, Flyfish325. I'm not going to name the veterinary hospital. My old vet accidentally overprescribed metronidazole, an antibiotic, to my dog for 30 days. I asked him if it has any side effects. He said no. 21 days later, he couldn't walk. The first vet at the emergency hospital told me that he had a back sprain. 2 days later, Cooper was having seizures, drooling, eyes twitching, and he couldn't stand. I took him back to the emergency vet, and the second vet said that he had a brain issue. I asked both emergency vets, could this be toxic? They said no. I had to euthanize him. 3 days later, 3 days later, my vet called and said that he overprescribed metronidazole, and for too long. He said Cooper's symptoms were caused by the drug reaction. He didn't have a back sprain or a brain issue. The metronidazole could have been stopped and he probably would have been okay. I've been crying for 3 weeks. I do not trust vets anymore. My best friend is gone.
Yeah, I know. One thing I do have to say is I can imagine how she feels or felt, but I can also imagine what the vet must have felt.
Yeah.
Like for the vet to continue to dig in to what this could have been, that vet does need, as horrible as it like if you think about it, she also went to 2 different vets that also said the same thing. So how I look at that, even from a philosophical perspective, is I have a lot of respect for the veterinarian, the original veterinarian, to dig in and go and then phone her and take responsibility for what happened.
Yes.
Like that's heartbreaking for me, because I'm sure if that vet had been taught and given the correct advice, the correct information, that in fact those are fairly well-known symptoms of that antibiotic. Like that's not like anything kind of new. But for him to keep digging, he would have stopped it. No vet would continue giving something that they clearly know is going to create these horrific, morbid symptoms, right?
No.
So, that must have been very hard on that vet. And if this person's listening to me, it's a hard thing to say, but my hopes would be that awful, awful, awful situation in that vet clinic alone, hopefully that vet contacted the other vets, like Emerge and things like that some other animals might be spared. Because of that, right? If there's any saving grace for this woman, which I can't even imagine that there would be, but if there is. But you have no idea how common that is. It's common. It's really common, and it's because of this veil of not even in school, not being taught. Literally not being taught. And in school schools being supported and sponsored by drug companies, right? Like this is a much bigger issue than veterinary medicine. This is a very strong political issue for people and animals, right? Is that universities should not be sponsored by companies that gain.
Absolutely.
Right? That gain by the education. It shouldn't happen. It's a complete oxymoron. I have a lot of very close friends that are veterinarians, and I can tell you, I don't know a veterinarian that would intentionally, whether I agree with them or don't agree with them, that would intentionally give something knowing this. This is a very precise example of empowering pet parents to, I always say, you have to do your research on top of what your vet is telling you, because your vet isn't privy. All of the stuff that we're privy to, the vet universities don't even get that. It's completely banished by muzzling and not allowing them to see stuff like this. So when you speak to that, they can't even believe it. But if you show up with, print, and I always say print it off, copies of peer-reviewed journals and proof, highlighted, no, I don't want to give this. And it's not just that drug. It could be any drugs. Yeah, it's heartbreaking. It is. And it happens.
Absolutely.
It happens all the time. It happens.
Obviously, like, no veterinarian wants to harm any animal. And as pet parents, we also rely on our veterinarians to do, or to give us the answers, and many times, right? But what we also, actually, something that I do want to mention here, a tip for every pet parent that Julie gave us 4 years ago when we had this topic of antibiotics before. So there's definitely a time and a place where antibiotics may be the best treatment option, right? But here's a tip that I got from Julie years ago, which every single pet parent needs to remember, write it down in your phone or something. Whenever you or your pet are being prescribed an antibiotic, you have to ask these 2 questions. Number 1, is this a life-threatening situation? Number 2, is this an emergency situation? And if the answer is no to both of these questions, then that means that you probably have time, or actually that means that you do have time to get a second opinion from another veterinarian, and also start natural remedies to support your pet while you're going to see a second vet. And then, like, even when you go to a second veterinarian and get your second opinion, and as Julie mentioned earlier, asking to do a culture and sensitivity test would also be a really good way to just double check, or actually at this point, triple check, that it's really necessary.
And what antibiotic is going to be prescribed is the correct one. It is, the only saving grace, I guess, of this is that to date, right now, we still actually have more power over our animals than we do ourselves. Where, when you go to a doctor, because, well, in Canada, to second guess what a doctor says, or it's even more difficult because it's under a healthcare system. When you go to a vet, you're purchasing something and they're providing a service. You do actually have, it's starting to loop around where that doesn't feel like that anymore, right? You don't feel like that anymore, because with the lack of vets, people now are afraid, just like humans, that your vet's going to get upset with you and then you won't have a vet. Right? So you're scared you're going to lose your vet, and then what? Then you're not going to have any course of action. But you're still in that position where you can ask questions and ask if there's other alternatives, and I always say, this is the most powerful thing is that you're doing this before your animal's sick. I know people think I'm insane when I say this. I think every single solitary person should have an appointment with their vet when their animal is healthy.
Absolutely.
Bring in for 15 minutes, you bring in your wants and your don't wants, and you come from a perspective of working, being in a position where you're really respectful for what your vet is bringing to you, but it needs to be a mutual respect. right?
Mm-hmm.
And have questions and stuff answered before there's an emergency, before your animal's
Mm-hmm.
sick. Because in that position, you go from having your power up here to having your power down there. And then
Mm-hmm.
emotions get in the way, and then you're scared, and then you're like, no, you have to do this or else, this is going to happen or whatever, right? It's a really helpful place to be in where you say to your vet, if my animal gets sick, these are the steps that I would like to have. I'd like to have diagnostics. I would like to, I would prefer to spend the money on diagnostics than spend the money on drugs,
Yeah.
so that we can have an informed conversation of what's really needed and what really isn't needed. How life-threatening is it really? Can we try an alternative first? That way you're not eradicating them. You're not saying I don't need my vet, right?
Mm-hmm.
You're working with them as a team.
That is such a good point because we realize more and more that veterinarians are actually not used to pet parents wanting to spend money on diagnostics rather than a drug. That's why a lot of times they'll just say, here's a dewormer versus saying, okay, come in for a poop sample. We'll do a
Mm-hmm.
stool test first, right? So things like
It
that.
just It's unbelievable. Like I tried to educate vets because I had all my clinics in BC about even charging for time. There's this real weird value system of they only want to pay for something that they can get in their hand, or they don't want to spend, this and then not like, oh, I don't want to get antibiotics right now. I want to do a culture and sensitivity. Well, what happened? Then they're like, okay, well, what happens if I do the culture and sensitivity and I still have to do the antibiotics? Then I have to pay for it twice, pay for two
Yeah.
different things. They don't understand that. No, 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 no. You're not paying for two different things. You're paying for the correct thing first time, rather than
Yeah.
paying for antibiotics, then they don't work. Then your animal gets sicker. Then you go back in, right? And you're probably going to wind up having to do the test anyways at some point,
Yeah.
right? But meanwhile, your animal has suffered in this length of time. It's not saving you money by
Mhm.
any.
Mm-hmm.
I think a lot of clinics, I think they mean well, maybe that way, where it's like, oh, well, we'll just start this antibiotic now and we'll save the pet parent X amount of dollars doing this. That's just how they're taught. There's no saving anything. Like it
Mhm.
doesn't make any sense to me at
Yeah.
all. But it'd be different if someone came in and said, I have maximum $200. I can't spend more than $200 today on my animal. And it's
Mm-hmm.
really sick. And you're looking at it as a conventional perspective, going, okay,
Mhm.
for $200, the thing to help your animal the most right now is this drug or this
Yes.
antibiotic. That's
Yeah.
different, but it's really about communication, isn't it? It really
Yeah.
is.
Mm-hmm.
Absolutely.
Again, I want to give some more special attention to metronidazole, also known as Flagyl, which is, in my opinion, probably the number one antibiotic that we hear about the most, and is commonly given to cats and dogs that have symptoms of loose stool, diarrhea, and even giardia. So most pet parents that we speak to have no idea that this drug can come with very serious side effects.
Yeah,
And
because like you don't really see the package as
no,
well, right?
a
Like
lot
you
of
just
times
get
you
the
just might get
pills.
the tablets, like just the tablets, and that you would just poke out the aluminum packaging.
Yeah.
But in fact, the FDA has actually issued a black box warning, which is actually the most serious warning that the FDA will give, which most pet parents again will not see.
Mhm.
So I just want to actually read off what the FDA is saying, and I will make sure to link this into the show notes. So, quote, metronidazole has been shown to be carcinogenic in mice and rats. See precautions. Unnecessary use of the drug should be avoided. And I feel that that's what we're seeing all the time. is the unnecessary administration of this drug. So sometimes it's just taking a wild guess. Here, just take this, like for whatever reason it might be. And carcinogenic, for those that don't know, this means that this has the potential to actually cause cancer itself. So, moving down this warning list, symptoms can also include ataxia, which is a loss of control of body movements. And we have witnessed this so many times after in more particular dogs for some reason. A lot of times when a dog goes onto this drug, a couple of days, sometimes weeks later, they lose complete movement in their body. So they might be completely paralyzed. And we see this all the time. And it's just so heartbreaking because, again, this is a warning that the FDA is putting out, but pet parents are just not knowing about it. And they're confused because it's the veterinarians that are giving it to them. In addition to ataxia, another common side effect is that the FDA also states that seizures have also been reported after patients have taken metronidazole. So this is it's so weird because, like, I'm not saying that no, this drug should never ever be given because I think there's a time and a place for everything. But I do think that pet parents should be aware of the dangers of these drugs, at least the side effects. They should know the side effects and then make the decision on whether or not they want to give this or if they want to try, something that has been shown to work against diarrhea.
I don't know how to alleviate this problem short of empowering people, right? Like what you
Yeah.
guys are trying to do. Because, and I never say never, and I think the fight needs to continue to happen, or the conversations need to continue to happen. Where does this start, right? Like, is it starting in the hands of the vets, or is it starting in the hands of schools, or is it starting in the hands of like the universities? Like, where does this start and where does it end, really, right? And what's even worse is that, the more clinics that are big corporation clinics, the purchase and the overtaking of the majority of the clinics in the United States and Canada are now owned by big corporations. It's even worse. It's even getting worse because not only are the veterinarians in that situation where they're not learning in school, but then they're put in a situation where every clinic is so standardized and so meticulously controlled of what they do and how they do it, that it's even removing more the veterinary's ability to choose what they feel in their hearts are the best decisions, right? Like I've witnessed it myself many times where I've now that I don't have my clinics, and I haven't had my own clinic now for 11 years. And so when I have to go to a clinic, my struggle that I've had with clinics that I've started with that were self-owned, right? Like individually owned by one owner, and then they get bought out by a big corporation. The name stays the same, the vets stay the same, everything seems the same, but you go in and you start asking for the same thing as you asked for before, and they can't do it, right? That doesn't fall, for some reason you aren't allowed to do this, or they're not allowed to do that anymore, or that's not the lab that they work for, or they can't use that lab anymore. They can't send your blood work out to a different lab. They have to do everything in house. It's all about corporate, right? It's becoming more corporate. The more corporate it's becoming, the more dangerous it becomes for our animals, without a doubt. It's becoming very business oriented, and so not only are they not being taught at school, but then they're being mandated to perform things and sell things and prescribe things and follow a certain protocol, right? That is, like, for me, that's heartbreaking. And when I look at the lack of vets and the amount of vets that are having nervous breakdowns and stress, going off on stress leave, and us not being able to find enough vets, funnily enough, that's walking right side by side by big corporate coming in and purchasing all the vet clinics. Because to me, I see them, they're not practicing how they think is the best way to practice. They're being told how to practice, and I don't know one single vet that doesn't stress them out. Inflammation of the brain is a big for that drug, right? So you would think, you might not want to scare people. You might not want to, if someone says to you, oh, what are the side effects of this drug that you're giving my dog, or this antibiotic that you're giving my cat, or whatever, they may want to come right out of the gate and say, well, swelling of the brain, because most people would be like, forget it. I'm not giving this to my animal. So they're not even told about it because it's considered a really rare side effect, right? So when someone phones in and says, my animal's dizzy, my animal's ataxic, my animal's staggering, my animal's doing this, they don't even correlate it. It doesn't even, the dots don't even connect. Because they're so shut off by it. It's why people really do need to do their own research and be prepared,
and it's so crazy because I'm thinking about like the real stories that people come to us for. And when they tell us, oh, I gave this drug and then my dog went crippled, how many of them then go, it must be a bacteria that's in the food that I'm feeding to my dog. And it's just like, it's so crazy, that you can have a drug that literally is having a black box warning and telling you all of the dangers, and then people can, or food is still to blame,
I do want to give our listeners a very practical tip as well, though, on the way. If you are ever in a situation where, you absolutely have to give your dog or cat or horse or yourself even an antibiotic, there's no way around it and you just have to do it. Is there anything that pet parents can do to help prevent some of these side effects and help the body deal with the antibiotics a little better?
Yeah, absolutely. One would be to feed probiotics, but it's important to feed them 6 hours away from the antibiotics so that they have time to become effective and the antibiotics aren't just killing them right away. A lot of people think, there's no sense in even putting them on antibiotics or on probiotics until the antibiotics are finished. That's a very strong, that used to be a really strong thing that you don't do that. You do them. You just make sure that you keep them about 6 hours apart, separate. Yeah. So that's one thing. A homeopathic remedy called Nux vomica, right? Nux vomica is a really helpful homeopathic remedy to have on hand to help to derail side effects of any drugs, any chemicals, from a perspective of what it's doing to the cells. See, so we're talking about two different things now, right? So what are the side effects that are having on the cells, like inflammation of the brain? And, that has nothing to do with your microbiota, right? That has everything to do with the chemical interaction that happens to the cells and to the neurological system and things like that. So, using Nux vomica is very helpful for that. I always tell people to support an animal's liver when they're on antibiotics, because that's very, you want to look at trying to check off all the boxes of what can go sideways when you're using drugs or antibiotics. So there's an easy way of doing it, and that is probiotics, homeopathic Nux vomica, supporting the liver, and antioxidants. When you think about those 4 things, those 4 things should be in your arsenal, should be in your toolbox, no matter what drug you're using. Doesn't matter whether it's antibiotics, doesn't matter whether it's a, an immune suppressive drug. It doesn't matter. If it's a drug or a chemical, those are the 4 highlighted things that you need to look at to support your dog or your cat or your horse or your body to be able to maintain its integrity and its balance given any drug, antibiotic or ketoconazole or an immune suppressive drug or anything.
Yeah. Thank you so much. That was such good advice, and so important for pet parents to, when we do have to give conventional medication, to also just do something to support the body proactively and help our pets continue to thrive even after the medication. So thank you so much for that advice.
Yeah. And one other thing I would say is a journal, right?
Yeah.
So we quickly forget let's say, I don't know, let's use a different antibiotic now. Let's use amoxicillin, so your animal goes on amoxicillin for whatever reason, that individual animal doesn't tolerate amoxicillin very well. It's really good to know and have those in the records so that when you go in again and they want to prescribe something, you can say, my dog or my cat or my horse does not do well on that. So you avoid the things that for sure your animal doesn't tolerate. Why would you continue to put an animal on something that it doesn't tolerate? But a lot of clinics don't do that, right? They don't look at, they didn't tolerate that because it even has classifications, right? COX inhibitors, this kind of thing, that kind of thing. Like knowing what your animal individually doesn't tolerate gives your veterinarian or yourself to say, I don't even want you to give something in that classification. I want you to avoid that classification if you can and look at a different drug. Look at a morphine instead of an NSAID, or look at this instead of that. Like keeping journals and knowing what your animals do well on and don't do well on is also really important.
Thank you so much, Julie, for taking the time today to sit down with us and talk about this super important topic. And we hope it's going to help a lot of pet parents make decisions for their pets that are going to help their pets thrive.
You're very welcome. They're really important subjects, right? They are important. They should be taken very seriously. And, with the right education and the right information, people can make the right choices for their animals, which is ultimately what we want to do, right?
Thank you so much for tuning into today's episode. If you like this show and you like what we do here and you want to support us, the free and simple way to do just that is by hitting the subscribe button. Larry and I spent countless hours creating this podcast, and seeing our community grow really means the world to us and enables us to keep creating awesome content just like this.